everyone. We are here to present our contribution to this symposium with the research realized by the group of researchers of the two Portuguese partners of this project. This work is presented by Ermelinda Marques and me, Teresa Paiva. We will begin this talk explaining our research concern and consequently the objectives pursued in this work, framed by a specific territory and explaining our major results. The neurodegenerative disease has a heavy impact not only in the patient's well-being through the social health, psychological and physical aspects of the illness, but also on the well-being of their families. With this type of diseases, this research will address only 3 of them, since they are the ones that generally occur with more intensity in the elderly population. Alzheimer's and Parkinson's are 2 types of neurodegenerative diseases that are linked with age and therefore important to analyze in a country that demonstrates an aging population, and consequently where care and support to these patients and families are much in need. With this study, we pretend to reflect on the situation and analysis of the neurodegenerative diseases in the border territory between Portugal and Spain, specifically on the Portuguese side. Portugal has a population around 10.2 million people that present the most common Western population characteristic, an aging population. Has 21.3% of the population above 65 years old and an aging index of 159.4. When we analyze the geographic distribution of this number, we observe that even if the majority of the population is concentrated in the cities and territory by the sea, most of the elderly people are located inland and near the border with Spain, where our study is focused. The region of Bragança and Guarda are in the northeast and center-east of the country and have respectively 1.2 and 1.4% of the Portuguese inhabitants. Not surprisingly, Bragança has a high aging population index, even above 500 in some localities, suffers of a demographic decrease and a low population density, low social-economic status and low health literacy, but offers a good health infrastructures. When we look closely to Bragança region, we may observe an aging distribution of the population quite peculiar. Of course, they have a percentage of elderly population bigger than the younger one and more men than women. But within these elderly people, they present a higher number of people with more than 75 years old. Guarda region has a very similar characteristics to Bragança. It presents a population with low density, low socio-economic status, low health density, and a demographic reduction, despite having more inhabitants. It also has an aging index above 500 in some localities and offers the same health, good care infrastructure. But looking carefully to Guarda region, despite the common observation of the bigger percentage of the elderly people and more women than men, it shows also a more even distribution of the people above 60-65 years old than Bragança. Regarding the neurodegenerative diseases studied here, we know that in Portugal dementia affects 1.31% of the population, multiple sclerosis affect 0.05% and Parkinson 0.25%. Analyzing this disease and following their international classification code for primary care to collect data, we were able to gather information from the local health units of both regions that represent the active diagnosis case. But it's not possible to say if the patients were institutionalized or not, or if they live in rural or urban areas. We observe that both Bragança and Guarda regions have more patients with diagnosed dementias than with Parkinson or multiple sclerosis. We must emphasize, however, the difference between these regions regarding not only the higher number of cases that Guarda signals of these diseases, but also the bigger gap on the case of multiple sclerosis and Parkinson. When comparing these cases per 100,000 inhabitants, these regions present similar situations of the country, in the case of dementia diagnosis, showing a big gap again in the multiple sclerosis and Parkinson, with Guarda having more cases per 100,000 people. This board presents the proportion of inhabitants per active diagnosis of neurodegenerative diseases, and we observe that the numbers are always higher in women, particularly in the case of dementia diagnosis. The graphic perspective shows the same panorama where dementia and Parkinson affect elderly age groups, which is justified in these regions since they show an aging and low resources population. Still, we must emphasize the case of the multiple sclerosis that affects more younger people. In behalf of the elements of the two Portuguese teams that developed this work, we thank you for the attention and the opportunity to present this work.